So, I think we've seen a slight divergence in what's happening in Niagara over the last few days versus what maybe is showing up in the overall provincial pattern. If we're watching the overall provincial pattern, it's really continued what we've seen over the last month or so, where there's been this slow, gentle decline in cases. When we move to Niagara, though, unfortunately, we are seeing a small increase, largely linked to activities that happen around the Thanksgiving time. Thanksgiving parties, weddings, those sorts of events. And that seems to have led to a small increase. And that doesn't really seem to be showing up as much in the provincial data. Now, the provincial data is also the aggregate of the entire province. So maybe this kind of bump is happening in some areas and not others, and it sort of balances out and you don't really see it as much. If we take a look at sort of what our neighborhood here has been, and that I've been comparing us in terms of other local public health agencies around the GTHA and then others of sort of similar size like Middlesex, London, and other urban centers like Ottawa, this has kind of been the pattern. This is the provincial data. It only goes up to October 21st. So just when we're starting to see our increase around Thanksgiving. And you can see that actually the rest, all of these regions largely were about the same and staying flat. You see an increase here with, I think, Brant County there, as well as an increase in Middlesex, London, but nobody else was really seeing much of an increase at that time either. And so this will be something I'll be paying attention to over the next week to see as the more updated data comes from the province, if we're seeing that kind of bump happening around this week in other areas as well. As you can see, even in Niagara, you don't really pick up what that increase has been yet because only the first bit of it was. And as you average over 7 days, it wasn't quite enough to show that increase. The Ontario Science Table came out with their latest modeling on Friday. And I think, based on what they were seeing as the provincial trends, it was certainly, I think, encouraging. They're showing that downwards trend in cases could manifest in sort of this range where we could have, the optimistic scenario where cases continue to go down. Or we could see increases where people are heading more indoors. They're going to be socializing more. We're going to have Halloween, US Thanksgiving, Christmas, those kinds of activities that might allow more social activity. And you would see then that increased contact leading to a rise in cases. But the good part is that because over these past couple of months, we've been able to keep cases suppressed, we've gotten our vaccine coverage up by about 10 percentage points or so, which has actually really changed what the trajectory of an increase in cases could look like. So it's no longer a potentially sharp increase. It's more likely to be a smaller increase. And I think that's quite positive. Of course, all of this is assuming that, as they say here, masking, vaccine certificates, improvements to ventilation, symptom screening, all of those other COVID precautions continue. And it's, of course, assuming that there's going to be some increase in contacts, but it assumed as certain variables. If that increase in contacts is much higher, of course, you might see an increase in cases going up. But I think the positive part here is that, at least in the next month or so, within the scenarios they're plotting out, it doesn't look like we're going to see a major increase in cases, which of course will translate into lots of people not being in hospital, lots of people not having their families go through turmoil of having someone severely ill, and of course not seeing any sort of need for new lockdowns or additional really stringent public health measures to prevent the spread of infection. With cases trending down, of course, you'd expect hospitalizations would be coming down, and that's the Ontario data showing that that's largely still the same. It's maybe flattened out a little bit of late. The ICU numbers likewise are slowly trending down. And here in Niagara, it's maybe a little noisier, but definitely it's at worst a kind of flat trend of what we're seeing in our hospitals and our ICUs. And what the science table is saying is that that's really what we can expect for the next month or so. Even if cases start to go up, which would be this red scenario, the time lag between when someone becomes infected with COVID-19 and they become hospitalized would be long enough that we would really see it in the next month or so. And that would at least give us, because we've been able to keep hospital numbers pretty low compared to, say, where we were in our third wave, that gives us some wiggle room that if things started to head upwards, we would have time to react. I think a really key message, though, that the science table is saying in the slide I showed earlier is the importance of maintaining all of the other precautions. And they even say this in terms of their key findings. The combination of vaccination and continuing measures to control the pandemic, that combination is really important to make sure we keep COVID under control going forward. And I think that's something that I'm going to be very much paying attention to, not just the vaccination rate, but also things like this, the mobility of people in society, how much more are they up and about, and is that going to start increasing, in which case we might worry that we're going to see more infection spreading. And fortunately, the provincial level mobility here is staying pretty flat right now, I think, which is good. This dark line, which I'll come back to in a bit, is a measure of how intense the preventive measures the government puts in terms of restrictions and socialization on society. And you can see that's been pretty flat since late July when we moved into step 3, and it's not changed much. And the province is, of course, announced where they're going to start to see this drop a bit more. This is the Ontario data. If we're looking at mobility in Niagara, this is people staying home, and you can see, if anything, there's probably been a small increase in people staying home of late, probably because the weather hasn't been as good. And if, about people going out shopping, recreating, that kind of high risk activity where you might be socializing with others, we've actually seen a bit of a decline over the last month or so, I think, probably as we got past the holiday season. And that's probably contributed to our ability to actually get cases back down under control during that time, that people have been partaking in some of those high risk activities less. So, that I think bodes well that at least in the near term, we should hopefully be able to keep cases under control. But the concern, of course, is we're going to get to, high premium shopping seasons around Black Friday, Christmas. There's going to be a lot of parties around Halloween. Maybe some people party around US Thanksgiving, Christmas time. I worry that we are going to see this line start to head up, and that's going to mean more socializing, more interaction that could lead to the spread of infection. And maintaining some of the preventive measures we have in society is going to at least mitigate the impact of that going forward. I thought the science table had this interesting slide here where they showed in the Nordic countries where they basically completely stopped all of their preventive measures. They stopped masking, they stopped, keeping distance. And what they see here is that there was basically a new wave of infection. So this gray line here is Denmark. This blue line is Finland, and you can see their cases start to go back up, whereas we in Ontario have seen that gentle decline. And if you look at the vaccination numbers, Denmark actually has a better vaccination uptake than we have here in Ontario for fully vaccinated people. And that wasn't enough to keep cases under control. It really, the Ontario advantage here has been both having the high vaccinations, but also maintaining those other preventive measures going forward, because we don't want to pull back on those too fast, or we'll start to go the direction of a Finland or a Denmark. This line here goes back to that stringency index that I was talking about earlier. So this red line is the Ontario one, where since late July, it's been pretty flat in terms of the COVID precautions we've had in place. And you can see the gray line for Denmark and the blue line for Finland have gone much lower than where Ontario was, whereas before we were pretty similar. And that's a reflection that they've opened up much more, allowing those cases, unfortunately, to start to go up, because unfortunately, even though 75% plus vaccination rate is good, it's sadly not quite good enough yet that we're going to be able to keep COVID cases under control. The closer to home example of what happens when you lift COVID precautions is, of course, what we've seen in our friends in the Western provinces here. And I'm here actually not even going to look at cases, but I'm going to look at deaths. Of course, as cases go up, there's sadly more of a small percentage of people who have those really severe outcomes and are potentially fatal outcomes. And you can see here where Alberta and Saskatchewan, how high their deaths have been, really mirroring what they went through in the second wave of COVID-19, much higher than they were during the third wave there. Whereas here in Ontario, you can see our deaths have stayed quite low. And I actually did the math here from the point that Alberta and Saskatchewan opened up in July versus now. In that period, if we had followed the pattern that Alberta or Saskatchewan has, we'd be seeing in the order of between 65 deaths if we went Alberta's way, or maybe 80 deaths the Saskatchewan way, additional deaths from COVID-19 during that time. And so the real, benefit that we've seen from our diligence of COVID-19 here in Ontario is that 65 to 80 people in Niagara are still alive today, thanks to our measures to make sure we kept COVID-19 under control. and prevented those people from passing away from COVID-19. And I think that's a really important thing for us to remember of what the true human cost of it is and why we, as annoying as they are, really want to maintain these COVID precautions, because it's really actually making a real impact on people's lives and keeping them alive going forward. The other area we're very focused on right now is, of course, schools, and particularly in elementary schools, we know there's a big group of the population who can't yet be vaccinated. And just to show you what our numbers in schools look like, we're up to about 171 cases now linked to a school. That doesn't mean that they got infected at a school. They might have got infected at a school, or they got infected outside of school and showed up while they were infectious in school and potentially put others at risk. And you can see that's gone up by about 20 since we last talked a couple of weeks ago. That remains about 15% of the cases that we're seeing. But those 171 cases have caused close to 2,700 contacts within those schools. And you can see that number's increased quite substantially. That's about 350 higher than it was just 2 weeks ago when we last talked. And I think that gives you a scale of how much even a small number of cases, 20 cases, can lead to 350 additional contacts. There's a huge impact on that. And of course, a lot of work that happens and a lot of disruption to student learning as a result. And so we really are looking forward to the day where vaccination will be an option for more of these students so that they can get that protection and they don't see their education disrupted in such fashion anymore. These 171 cases, just to show, have actually impacted a total of 70 different schools, and we've had a total of 15 outbreaks occurring. I highlighted how, particularly in elementary schools, we have some children who are younger than 12 years of age. And unsurprisingly, you can see our cases are overwhelmingly in elementary schools. That's the schools where we're seeing the most cases linked, probably because that's where the students are unvaccinated. Whereas in secondary school, they at least have the benefit of vaccination. They're more likely to show up having a case in the school. And likewise, we can see the same pattern with contacts. Overwhelmingly, the students who are contacts are in elementary school. And unfortunately, because they are unvaccinated, that means when they are a contact of a case, they have to stay home, they can't go to school, and they're seeing their learning disrupted. In terms of where we're seeing the spread of infection to these students in schools, it remains overwhelmingly they're getting infected from members of their household. Other important sources, of course, are other members of their family who might be visiting, friends who might be visiting, or they visit. Some spread, of course, is occurring within the education sector. But I think this is, a really unfortunate statistic. And if we could make sure that everybody who is around children, if they have children in their home, they're visiting children, they have children in the extended family, if they could get vaccinated, that would cut in half the number of students who unfortunately are getting sick with COVID-19. And probably about half of the students who unfortunately as contacts are really seeing their education disrupted. I really think, getting those group of people vaccinated could be an easy win here to make sure we prevent the spread of infection. And then, of course, once we can get vaccination for children, we can start to prevent some of this spread within schools by, of course, vaccinating more of those students, so there'll be less spread within the schools. I think it's instructive then to, look again at what the age pattern of our spread in infections here is. You can see the pattern here with the yellow being the under 12, which is a group who can't be vaccinated. And you can see for many weeks, that has been the group that has actually had the highest COVID cases per population. We actually had last week where we fortunately had very few additional cases within the school. I'm not sure that's going to necessarily persist going forward. So there's maybe a blip downwards, but you can see how being unvaccinated really is putting that group at risk. I'll show in a moment, which you've probably seen, that the 12 to 29 age group is the least vaccinated group in our society that is eligible for vaccination, and they are next highest in terms of cases. And then when you go to, the 70 plus group, this is the blue line, you can see they're actually at the bottom. They have the highest vaccination uptake. And I really think our priority needs to be to make sure we get these 12 to 29 age group vaccinated. Make sure once we get vaccines for under 12s, we get them vaccinated, because that's going to do the most benefit in terms of stopping this spread of infections. And of course, if we stop the spread of infections amongst this group, they won't be spreading it to some of those older groups. And that'll really make a big difference in the pandemic. And I think that's one of the reasons we're very much looking forward to here in public health, the potential that we could have a vaccination for age 5 to 12 within the next couple of months before the end of this year. And I think that'll be a real game changer in schools and could really be a game changer for spreading our community as a whole by basically bringing that yellow line right down and basically having a spillover effect to less infection and spreading to those other age groups. One reason I highlight the age 70 plus is, of course, there's been a lot of talk in the United States about waning of immunity and how they are now doing third doses. And I think they're doing third doses both for the 60 and up and the 70 and up group. And you can see both those groups here are actually the lowest spread of infections. And so I would posit that it's a strategic error to be vaccinating the 60-year-olds and the 70-year-olds and upwards. That's where we're seeing the least spread of infection. And our focus should be on where we're seeing the most spread of infection, because that's the group that's really extending the pandemic right now. And if we can convince them to be vaccinated, that's going to make the biggest difference. Doubling down to do third doses on the group where there's very little spread of infection is really not going to make a big difference in society. The big difference is going to happen when you get the unvaccinated groups to be vaccinated. Now we can see here, vaccine remains very effective. The science table here calculates that, amongst unvaccinated people, this is what the case curve has looked like. This is what it's looked like for vaccinated people. And you can see that's a 7-fold difference they highlight. And of course, the increase we saw in cases in August and early September and then coming down is basically all reflected in the unvaccinated people. Yeah, there's a small increase in vaccinated, but it's pretty tiny. The pandemic is really being driven by people who remain unvaccinated. And that difference is even more stark when we look at hospitalizations, where there's a 17-fold difference, in ICU admissions, where there's a 23-fold difference. And again, you can see there's almost nobody here being admitted to an ICU who is vaccinated. If you're unvaccinated, that's really where all of it's happening. Likewise, very few are being hospitalized with COVID-19 if they are vaccinated. It's really if you're unvaccinated, that's where all of the risk is. And I think it's a really important message we want to continue to push, that if you get vaccinated, this is what's really going to keep you safe going forward. I just want to highlight again, returning to that conversation about waning of immunity, what we're actually seeing. So this is the vaccine effectiveness for symptomatic illness. And we're looking at people 16 years of age and older. And then this is looking at different intervals of having received the vaccine. So you got your vaccine, with the 2 doses within 7 weeks, 2 doses within 8 to 15 weeks, 2 doses within 16 to 23 weeks, 2 doses within 64 to 31 weeks, and then your 2 doses were more than 32 weeks apart or 8 months apart. And you can see here, sorry, no, I've got that wrong. This is looking 7 weeks out, 15 weeks out, 23 weeks, 31 weeks out, and 32 weeks out. These are the intervals here where you got your 2 doses within 35 days, between 35 to 55 days, between 56 and 83 days, and more than 84 days, or 12 weeks apart. And you can see that if you got your vaccine doses close together, 35 days apart, there is a little bit of waning of immunity that you see. Likewise, 35 to 55 days, a little bit of waning of immunity you see, but people still have 80% immunity. So that's still very good. It's not quite the high into the 90s as it was right afterwards, but it's still quite good. But I think it's notable when you look at the blue and the green trends here, that blue line doesn't come down the way the yellow and the red line come down. So people who got their doses farther apart, which I think was actually the majority of people in Ontario, they're not going to see that waning of immunity, at least as early as some of those other groups, and it's going to hopefully persist longer term. I also want to highlight that even where you got some waning in that yellow group, which got their doses 35 to 55 days apart, they saw their effectiveness stay higher than those who got it closer together. And I think that's the really key message we've been hearing for a while, that if you got your doses farther apart, you seem to have both better immunity and you maintain that immunity longer. For looking at severe outcomes, you can actually see that it's a little bit different, where now you don't really see any waning across all of the different intervals. And so waning is really just, the breakthrough infections we hear so much apart is people getting symptomatic illness that doesn't require any hospitalization, is not a severe threat to health, it's largely just about more people are getting symptomatic illness. And I think, again, that's another reason why I think we should be careful about going too far onto third doses. If we're vaccinating a lot of people with third doses to address this mild illness when we're not seeing much severe illness, I think we're distracting ourselves from what's a real concern. If we get to the stage where everybody's vaccinated and COVID spreads through us and we all get colds, I don't think that's a big issue for us as a society anymore. We have lots of cold viruses circulating. What we need to do is make sure we vaccinate people so we can get these severe outcomes to end. And it looks like that protection persists long term. Here we're then looking at symptomatic illness versus severe illness in the 7-year-olds, because that's the group where there's been talk about having third doses. And you can see even in that 7-year-old, severe illness really doesn't wane over time with the vaccine. Yes, you do get more symptomatic illness, mild illness, but not severe illness. And so I really think the third dose conversation is one that we should be cautious about, because I don't think it's really going to serve us long term. What's going to serve us long term is about making sure everybody who is not vaccinated gets vaccinated, so we can get everybody on this line where severe outcomes, threats to our hospital sector become a thing of the past, and really able to move on from what all the really intense measures we've had through this pandemic to try and control the spread of infections. So I'll stop there and turn it over to questions.
Great. So first on our list, we have Alan, and you should be able to unmute now.
Hello, thank you. Okay, wondering if you can update us on some of the outbreaks we're seeing in long-term care homes, number of patients, and the severity of those outbreaks.
Yeah, for the most part, when we've had long-term care home outbreaks, they've been very small outbreaks, under 5 people. In many cases, they've actually really just impacted the staff and not really even spread to the residents. And I think that's a really good news story. That being said, we've had a couple of larger outbreaks where infection has spread to staff, to the residents, and has started to spread amongst them. And sadly, we've had some residents have some severe illness. And I think the third doses that have been now administered in that setting will hopefully make a little bit of a difference for that group. I think the most important thing, though, is we need to stop people who are unvaccinated from potentially bringing infection into those long-term care homes. I know the Ministry of Long-Term Care is tightening up their vaccine requirements for staff, and I think that's going to make a big difference. And then the other area where is going to remain a risk is going to be visitors who may be unvaccinated, are still going to be able to come in and visit their loved ones, and potentially could bring infection in. I think that'll be our weak point going forward with these long-term care homes.
Excellent, thank you. Yep. There's a new community outbreak reported today. Is that a business? Can you give us any details on what that might be?
I can say it is a workplace where we've seen the latest community outbreak, and a good proportion of our outbreaks of late, close to 50%, I think, have been workplace outbreaks. And I think you probably saw a media release from us about 2 weeks ago or so, where we are really pushing the message around it's really important workplaces think hard about having a vaccination policy, because that's going to make sure workplaces don't get disrupted with these outbreaks, are going to be able to keep operating. You'll be keeping your employees safe, and you'll be keeping your customers safe.
Thank you.
Thanks. Up now we have Paul, and you should be able to unmute.
Can you hear me okay?
Yep.
Oh, great. Dr. Hergy, you mentioned about the importance of keeping people from introducing infections into long-term care homes. Do you think we should the local hospitals have a policy where all visitors, I'm talking about the hospitals, not the long-term care homes.
Yeah.
Should visitors to local hospitals have to be fully vaxxed?
I'm not sure about that. I would certainly want to strongly recommend that visitors be fully vaccinated before entering the hospital. We've not really seen hospital outbreaks, and certainly not ones tied to visitors. So we've fortunately not had that same level of risk there. So that's why I'm a little bit more cautious. This could just be, the luck of the draw, and we sadly will have that going forward. I'm also mindful that if someone does have a family member who's hospitalized, could be palliative, you really don't want to deny them that last opportunity to say their goodbyes in terms of that. So, I would be a little cautious about necessarily going out strongly to require that right now, but it's absolutely something I would strongly recommend, and at minimum require testing for people who are unvaccinated coming in to visit someone.
And follow-up?
Great, and I think you used the example of Denmark and Finland as two countries that have seen their caseload start to increase pretty rapidly after they've reduced restrictions. So I think would your advice be to the province be cautious about further relaxing restrictions as we get into the new year?
Absolutely. I think caution is very much warranted. I don't think that means we do nothing. I think there's opportunity to take small steps in terms of continuing to lift restrictions a little by little, seeing what happens over the course of 2 or 3 weeks, and then taking the next step and lifting the next things. And it'd be nice to, kind of work down a list of, what are the most onerous restrictions out there, both economically and to people's lives, and work your way down to slowly lift those as we go forward. I am worried when we do have, something like the announcement last Friday, where there's going to be a wholesale lifting of restrictions on a timetable of January 17th, and then eventually to everything lifted March 28th. I really think decisions like that need to be based on conditions on the ground rather than a timetable set out in advance.
Thank you. Okay, up next we have Ludwig, and you should be able to unmute.
There we go. Can you hear me?
Yep.
Thanks, Courtney. Hello, everyone. Good morning, Dr. Hergy. Just wondering if you could speak a little bit about the vaccine requirements as it relates to your own departments, the regional staff, as we know, have a vaccine requirement. So I'm wondering if you're able to say anything about how that has played out in terms of because we've heard across Ontario, some nurses, for example, just leaving. Essentially, they don't want to get vaccinated and subsequently being laid off. So I wonder if you could talk a little bit about how the vaccine policies have been received and working out at the region.
Sure, and you can actually look at a memo that went to Regional Council last Thursday on the agenda, and that actually goes into a little bit more detail. Overall, what we've seen in Niagara region is that only about 3% of people are actually refusing to come into compliance with the vaccination requirement. Everybody else has, gotten fully vaccinated, which is, I think, 88% of employees has gotten their first dose, is on their way to getting their second dose. And then there's a proportion of people, largely people who are on leaves, those sorts of things, where they haven't yet reported their status because they're not currently active employees. There's only 3% who right now are refusing to come into compliance with that policy. I think that's pretty good statistics. It does mean that overwhelmingly the staff we have working in the workplace, and more importantly, serving our clients, are fully vaccinated and are going to make sure that our clients are going to be safe when they interact with us in public health or with the rest of the region as a whole.
And follow up?
Yes, thank you for that. So my second question, I don't hear as much talk about variants right now in your briefings. Variants obviously was a big concern earlier, and there was a lot of attention given to what type of strains we're seeing. So could you give us a helicopter view of like what the variants are looking like right now, and what are you zooming in on when it comes to variants that might not be as prevalent in Canada yet right now?
Yeah, so the story about variants has become fairly boring, which is largely why I haven't commented on it. 100% of our cases are basically Delta variant. 100% of what's going around in Ontario is basically Delta variant. You get the odd other variant from someone who may have traveled elsewhere, and it just doesn't get much opportunity to spread, and it basically dies off, and you're back to just having Delta variant going around. What we're seeing around the world is that there are sadly new variants emerging in other countries. Thus far, we haven't really seen a variant that is going to spread as easily and as quickly as a Delta variant. And what that means is that if that variant shows up in Canada, and when it's competing against the Delta variant is just going to spread faster. It's just going to basically, crowd out that other variant, and it's going to take over, which is really what the Delta variant did when it showed up on the scene. It spread so much more easily, so much faster. It basically outcompeted all of the other variants. And so that's the situation we're really on. the Delta variant is, really incredibly more infectious than what we started with. If we're looking at the original version of COVID-19, by some estimates, the Delta variant is up to 8 times more infectious and spreads about 8 times more easily. So it's really hard to control, but it also means it's really hard for another variant to emerge that's going to be just as infectious or even more infectious than that. And I think in some ways, the fact that the Delta variant spread so easily is kind of keeping all the other variants off our radar for now, because the other variants just can't compete. And fortunately, because the vaccine still does work reasonably well against the Delta, I shouldn't say reasonably well, it works quite well against the Delta variant, even if it wasn't quite as good as we initially hoped, it's still working very well. And that means that we are able to continue to rely on vaccines to really hopefully get us to the end of this pandemic.
Thanks. Up next, we have Linda, and you should be able to unmute now.
Hey there, can you hear me?
Absolutely.
All right, so I just wanted to ask about Pfizer. They've, they recently tried to ask Health Canada for approval on use of the vaccine for kids age 5 to 11. So do you think Health Canada is going to approve?
It's hard for me to guess that stuff. I haven't seen the details of what they apply to, and I don't know exactly, what are the things that Health Canada would be looking for. So I wouldn't know for sure. Certainly, it sounds like Pfizer seems very confident, and they, of course, have applied for multiple vaccines through Health Canada, including the adult version of COVID-19 vaccine. So my best information would be to really look at, Pfizer's confidence and expectation that they've probably done their homework and they have a good submission and will hopefully get that vaccine approved. But this is me just, looking at what I'm seeing and not really having any kind of inside information to say what Health Canada's thoughts are.
And a follow-up?
Yes, so I also wanted to ask you a little bit about, you addressed the Premier's decision to lift capacity restrictions. Do you think it's too soon to make the changes that he announced on Friday?
I would have preferred that the capacity limits maybe had been held off for another week or two, just to make sure we weren't seeing a Thanksgiving bump. We've seen a little bit of increase here in Niagara. It's maybe not showing up in the overall provincial stats, but I think you need, the balance of this week before you can say carefully that, yes, we're through Thanksgiving, we haven't seen a rise of cases, and it's safe to maybe do the next step of lifting measures. The other part I was a little disappointed by in terms of the announcement to lift the capacity limits is that it didn't close off maybe some of the loopholes that we have around the vaccine certification. The premise of the taking away capacity limits is that in areas where people are fully vaccinated, because everybody's vaccinated, there's much less risk, so we don't also need the capacity limits in place. Some places, though, where that's not entirely true is when it comes to, outdoor dining. There's no requirement right now to be fully vaccinated, yet the capacity limits are going away for that. I don't think it should have applied there, or we should have brought in a vaccination requirement for this outdoor dining. Similarly, for organized youth sports, there isn't a requirement to be fully vaccinated yet. I think we should have seen a requirement to be fully vaccinated there, or maintaining capacity limits there. And then finally, for the staff of all of these facilities, restaurants, gyms, etc. You can go out to have dinner, you'll be inside that crowded restaurant now. Everybody who is dining is going to be fully vaccinated, assuming they're eligible to be vaccinated. But the person who's going to be coming and serving you is going to be face-to-face with you is not going to be fully vaccinated. And I think the province should have taken this as an opportunity to bring in a requirement for those staff to be vaccinated as well. And so it would have been, we'll lift the capacity restrictions, but we're going to make sure we get a broader base of people fully vaccinated in these settings to really minimize that risk of an outbreak. And I think that would have been a really good trade-off, which I was disappointed they didn't make.
Thank you. And up next, we have Penny. You should be able to unmute now.
Hi, thanks very much. Dr. Hirji, I'm hearing a little bit about a shortage of vaccines, and I'm wondering with the hopefully upcoming approval for younger kids to be vaccinated, are you confident that there will be enough vaccine in Niagara?
I'm very confident there will be enough vaccine in Niagara. The announcement that the federal government made last week is that they're going to have enough vaccine for every 5 to 11-year-old child for at least the first dose. Really pretty much as soon as Health Canada has approved the vaccine, we're going to get a shipment within a few days for that. So I don't think vaccine supply is going to really limit those first doses. I think, that's going to be enough at least for the first doses, but I imagine we may see something similar to what happened with, say, the 12 to 17 age group, where we had 40% of people immediately came forward to get their dose, and then it was much slower for the rest. And if something like that happens where only 40, 50% of people come out right away to get that first dose, we'll have the balance of that to get everybody their second dose on a pretty quick timeline. So I don't actually think we're going to see any kind of supply issues with delivering vaccines to that 5 to 11-year age group. It's really going to be up to their interest in being vaccinated and the parents' interest in getting their kids vaccinated, as well as our ability to deliver vaccines as quickly as possible.
And a follow-up?
Yes, you just mentioned your ability to get kids vaccinated as soon as possible. I'm sure you're working on a strategy for that. Is there anything you can share with us about what you have planned for if and when it's approved?
Yeah, so we have multiple scenarios at play right now. There's a lot of unknowns still here. We don't know when the vaccine is going to be approved, when we're going to have supply of vaccine arrive, at least locally, to be able to deliver it. I mentioned the government of Canada is going to receive it pretty quickly after Health Canada's approval, but how long it takes before it filters down to us has often been more like 10 days to 2 weeks. So we don't know exactly when we can start delivering vaccinations. We're also a little unsure still about who are going to be the others who are going to be in the vaccination game. We know pharmacists are quite keen to be involved in vaccinations. We're still hearing to what's going to be the situation with primary care and pediatricians. We think a lot of parents will want to take their kids to their primary care provider or their pediatrician to be vaccinated, and we're hoping they'll be really stepping up, but we are still getting a sense of how much they're going to be doing vaccination. And then, of course, we're going to fill the gap of what they and pharmacies don't do. So that's, it's a little unknown how much we need to be delivering. So we have multiple scenarios that we're looking in terms of that. And then beyond just, the different scenarios, we're doing lots of planning of how we would actually deliver our vaccines. Some challenges are that young children, you can't vaccinate them as quickly. They're going to be much more anxious. They're going to need soothing. Many of them are going to be crying. So we need to reconfigure how our vaccine clinics are going to work to deal with that population and make sure we make it a safe and comfortable and inviting atmosphere for them. When they're recovering from vaccines, we want to make, and even when they're at the table to get their vaccine, we're going to want to have lots of distractions for them. So it takes the thought away from that needle and onto something a bit more positive. So we're doing lots of work around that. Lots of our staff are new to the vaccine game, and so we need to train them up on how they do vaccines for this younger age group as well. And then we're also trying to figure out what would be the sites we deliver our vaccines at. The sites we had for our mass vaccination clinics earlier this year, sadly, are largely sites that we no longer have access to. The operators of those, in many cases, are municipalities, have resumed their normal activities with those sites, and they're no longer available for us to do vaccination. And so we're identifying a whole set of new sites that we potentially could use and figuring out what mix of those sites is going to make the most sense in terms of vaccinating those kids. So a lot of work going on. I think as soon as we know a date of when we'll have vaccine, we'll get an announcement pretty quick out about what our plan is, where our clinics are going to be, how many we'll be seeing, so we can start to get everybody signing up for those clinics.
Thank you.
Okay, so that's gone through everybody in the list. If anybody has any second questions, since we have time, if you can let me know in the chat, we can let you unmute. Okay, well, I'm not seeing anything. So thank you everybody for attending. And as always, if you have any further questions, feel free to email myself, Alex, or Lisa, and we can help you get that information that you're looking for. Thanks.